All right, good afternoon. My name is Dr. Jason Burnett, and for the next hour or so I'll be talking to you, or I'll be presenting the first sequence of a sequence of 3 for identifying and intervening cases of elder abuse. And this project is funded by the Health Resources and Services Administration of the Department of Health and Human Services. The grant was initially funded in 2007 with renewed funding for 5 years beginning in 2010. And so by the end of this discussion, end of this presentation, what you should be able to do is describe 3 types of elder abuse, identify signs and symptoms that raise suspicion of elder abuse, and identify 3 factors that put older adults at risk for elder abuse and neglect. So we'll start with a definition. What is the definition of elder abuse? And the National Center on Elder Abuse defines it as an intentional or neglectful acts by a caregiver or trusted individual that lead to or may lead to harm of a vulnerable elder. And the thing you want to really focus on is that idea of a trusted individual, because what that does is that lets you know that it differentiates elder abuse from other types of fraud or homicide or abuse, and it includes specifically people that have a trusting relationship with the older adult. And there are several common types of elder abuse that we do see, which are physical abuse, neglect, which includes caregiver neglect and self-neglect, emotional or psychological abuse, there's verbal abuse, there's financial exploitation, sexual abuse, and there's also abandonment. And in many states, self-neglect is not a reportable condition, but the others mostly are. Okay, so let's talk about the different types of elder abuse. So what type of abuse would you think this is? This is a man who pled guilty to biting his grandmother, and during the deposition, the grandmother told prosecutors that she thought the beating would never stop. She yelled, she begged, but yet it didn't matter. What type of abuse would you suspect this is? Is it physical abuse, caregiver neglect, or abandonment? Well, if you chose physical abuse, you made the right choice. Because definition of physical abuse is the use of physical force that may result in some sort of bodily injury, physical pain, or impairment in the older adult, and it includes, but isn't limited to, acts of violence such as striking, beating, hitting, biting, pushing, kicking, slapping, and also it includes using drugs and physical restraints to restrain an older adult, also force feeding and physical punishment of any kind. Now here's a case where we had an aged care worker who raped an 85-year-old woman and yet only received 6 months behind bars. What type of abuse would you think this is? It would be caregiver neglect, financial exploitation, sexual assault, physical abuse. Well, it's actually sexual abuse, and this is defined as non-consensual sexual act of any kind with an elderly person. And this can include unwanted touching. It can include, battery such as rape, sodomy, coerced nudity, even taking sexually explicit photographs without the consent of the person. And one thing that you really need to think about is the fact that sexual contact with any person incapable of giving consent is considered sexual abuse. And then what about neglect? And specifically caregiver neglect. This is defined as the behavior of a caretaker that threatens the older adult's health or safety, and oftentimes it includes people who have fiduciary responsibilities to the older adult, so they have responsibility for maintaining their monies and using that money to get them the necessary clothing, the shelter, the hygiene, the medical care, the medications that they need to maintain their health and safety. And whenever these things are not done by that formal caregiver, it falls into the category of caregiver neglect. And here's a case of caregiver neglect where a husband let his wife starve to death. This gentleman, he was the husband of a mentally ill wife who he let starve to death on a couch, and in the end she ended up weighing a total of 63 pounds at the time of her death. And here's another case of caregiver neglect where a woman was a primary caretaker of her mother, and she frequently worked out of town, and when she left her mother pretty much bedbound. And so she was not, changing her mother's clothing, she wasn't bathing her, and she also, most importantly, was not actually turning her mother, which led to the development of decubitus ulcers and other types of injuries And here's a picture of that case. And as you can see, these weren't things that just happened overnight or in a day or so, or 2 days. These types of injuries take a period of time to occur, which shows the level of neglect that this daughter inflicted on her mother. So then there's also this category of self-neglect, and this is differentiated from caregiver neglect in the fact that there's no perpetrator here. So the definition is the refusal or failure to fulfill any part of a person's obligations or duties to an elder. And actually, what it refers to is the inability of a person or failure of a person to provide themselves those types of resources necessary for maintaining their health and safety. And so it excludes situations where a mentally competent older person who understands the consequences of his or her decisions makes a conscious and voluntary decision to engage in acts that threaten his or her safety as a matter of personal choice. And this is very important because we all do things that we may consider to be sort of harmful for our health, but if we're able to make that conscious decision, then it's not necessarily considered self-neglect. So we also have psychological and emotional abuse, and this is the infliction of anguish, pain, or distress through verbal or nonverbal acts. And this is usually by someone, as we mentioned, in a trusting relationship with the older adult, and they may use verbal assaults, they may insult them, may threaten them, they may intimidate them, they may humiliate them, harass them. And these things have deleterious effects on the older adult in the sense that a lot of our older adults have reduced psychological and physiological reserves to be able to handle these insults, which could lead to a cascade of events leading to worse health, poor quality of life, and even mortality, which is what we'll talk about later in this presentation. And there's also a type of abandonment, and this is the desertion of an older person by the individual who assumed responsibility for caring for this person. And this means you have a caretaker or someone who's assuming responsibility for the older adult and then leaves them alone. And this person usually is dependent on the caretaker for their health and for their safety, but yet they are left by themselves, maybe in a familiar place, maybe in an unfamiliar place. And so here was a case, abandonment, that came through the Texas Elder Abuse and Mistreatment Institute. It was an elderly man who was abandoned by his son in a motel. The incident was reported to Adult Protective Services, who referred the case to team clinicians knowledgeable about elder abuse. The elder man was found severely malnourished, dehydrated, with contractures and decubitus ulcers. And this was a very, very unsafe environment for him and very, very bad for his health, as you might imagine. And then there's financial or material exploitation, and this is a very, very common type of abuse that we see, and it includes the illegal or improper use of an elder's funds, property, or assets for monetary or personal benefit, profit, or gain. And this usually occurs when an older adult is dependent on someone, and that person then uses their assets. Maybe it's their bank account, or maybe it's they sell their home, or they get them to sign a will over to them, leaving their property, leaving large amounts of money to them. What ends up happening is the elder suffers because they lose their assets, they lose their ability to purchase their medications and to seek out medical care. And really, this is a very, very common occurrence, but yet it's estimated that 1 in 25 cases of elder financial exploitation gets reported to authorities. And there may be at least 5 million cases of financial exploitation each year. And it's even likely that these are underestimations of the extent of this problem because of reporting standards and statutes. And a lot of times, as we'll notice later in the presentation, these individuals often are living in their own homes, isolated from society. And one thing to think about is elder financial exploitation doesn't just happen to individuals who are not affluent, but it also happens to affluent individuals. As we saw in October of 2009, Marshall Astor, the son of Brooke Astor, who's very, very wealthy, he was convicted on 15 counts of defrauding his mother. Then there's this idea of undue influence, and this isn't necessarily a form of exploitation or a form of abuse. It's more of a process or method that's used to commit financial or sexual exploitation. And undue influence is the concept that a lot of times is needed to be preserved and shown to be evident in cases where elder abuse, of financial exploitation, or of the sexual exploitation type receive a conviction or prosecution. And so let's talk a little bit more about what undue influence consists of. An example of undue influence is when reciprocity is used to exploit a victim. So oftentimes what you might see is an older adult who depends on a caretaker will then start providing that caretaker with extra payments, maybe cooking their meals or paying for their meals, or giving them large sums of money when the caretaker's already being compensated. And then what you might also think about, influence becomes undue when the perpetrator exploits the victim's dependency and trust and steals from the victim for personal and financial gain. Like I said, this undue influence is what really needs to be evident for prosecution to occur, because a lot of times what a caretaker will say is, well, they told me I could do it. I could use their money to buy myself something, but what we have to show is that there is undue influence that was mediating that transaction. And so what are some signs of undue influence? An elder's actions are inconsistent with past values or beliefs, and physicians are in a really good position to be able to detect undue influence or have their suspicion raised about this, because they have a long-standing patient relationship with a lot of their patients, especially their older adult patients, because they see them pretty frequently. If a physician sees that an older adult is making decisions that don't necessarily go along with what they have done in the past, this may be a sign of undue influence. And the elder may make changes in their financial management benefiting one person in particular. This is very, very common, where an older adult will then change the way that they handle their finances, or they will start spending money in a way that really shows personal gain for someone other than themselves. The caregiver may dismiss any previous professionals and gets new ones for the elder, and this is really a way that caretakers try to maintain the perpetration, is because they are able to move to different physicians. That way it's not detected, because then it's not something that a physician can readily detect. Elder is isolated from the community. This is also common. We see a lot of elder abuse cases where they are isolated, and if we keep them isolated, from a perpetrator standpoint, then they're less likely to be scrutinized and detected. Or a non-family caretaker moves into the elder's home. This is also a sign of undue influence, because a lot of times a formal caretaker doesn't need to live with the older adult. Now, if they don't, if a physician has a patient who doesn't necessarily require 24-hour care, such as a bedbound person, and then all of a sudden they see a non-family caretaker moving into the elder's home, this may be a sign that undue influence is occurring. And so some other signs of undue influence is elder directs income flow directly to the caregiver. A lot of times you need guardianship, you need power of attorney to do these things, but sometimes the caregiver will talk the patient or the older adult into letting them handle their money. Wills, living wills, and trusts are also altered without the patient actually understanding what they're changing, or they'll be talked into changing these in order to directly benefit that caregiver. The elder may develop mistrust of family members all of a sudden, because this is something that caretakers like to do. It's part of that isolation of the older adult, as you move them away from their social support so that they can't be scrutinized and discovered. Perhaps the older adult gets a new caregiver who promises lifelong care in exchange of elder's assets. This is another type of undue influence. Power imbalance between elder and caregiver. You like to see this relationship to be more in the hands of the elder, and have that caregiver just there to help them with their hygiene and their care as far as going to physicians, getting their medications. But when that balance starts to swing in favor of the caregiver, undue influence may be occurring. There's quite a few others here, such as elder becomes frightened or despondent. This is a sign of undue influence, and elder places caregivers in an exalted position. And so now that we've talked about these heinous acts of elder abuse that occur to older adults living in the community and living in nursing homes, we have to ask ourselves, well, how bad is the problem of elder abuse? Is it something that occurs very often? Is it something that it's really bad but doesn't occur? And so let's look at some of the epidemiology. Now, on a national prevalence, millions of Americans aged 65 and older are injured, exploited, or otherwise mistreated by a caregiver or someone they trust. In reality, 2 to 10% of older adults living in the community or living throughout the United States experience elder abuse every year. As I mentioned before, this is likely a very underestimated range of actual events that occur, because there's different definitions for identifying elder abuse and for defining elder abuse, and there's different tools for measuring it. There's certain statutes that are available with different states that direct people to being able to report a certain type of abuse or not. And so this 2 to 10% is, like I said, it's a range that's occurred from various sampling and survey methods and case definitions. Now, if we took the worst case scenario and said, well, 10% is the actual number, we're estimating that about 4.4 to 5 million older adults experience elder abuse every year, and that's a very substantial number. And in fact, only 1 in 14 incidents of elder abuse in domestic settings, excluding self-neglect, are brought to the attention of authorities. And this is very important because what that means is we have a lot of older adults that are still living out in the community that receive abuse every day, and as we'll see later on, there are deleterious effects on their quality of life and their mortality. And then the most common type of elder abuse that we do see reported to Adult Protective Services is self-neglect, and it's increasing at alarming rates. And so the last national prevalence study, which was conducted by Ocierno et al., was a study of 60-year-old adults throughout the United States who were cognitively intact. Okay, and so the percentages you see here on this pie chart show that 4.6% reported psychological abuse, 1.6% physical abuse, 0.6% sexual abuse, 5.1% for potential neglect, and that category actually included caregiver neglect and self-neglect. And then 5.2% reported having been financially abused in the last year. And one thing to think about whenever you see these statistics is that this was self-report by these older adults, so there was no standardized assessment, and there are biases to self-report, but these are the best estimates that we have thus far. And overall, 11% reported being abused in the past year, and that's a really high number. And what Ocierno et al. Also were able to show is that there's a strong correlation between low social support and previous traumatic events and abuse. And then in 2004, there was a national study done on the rate of reporting elder abuse to Adult Protective Services across the country, and this was performed by the National Center on Elder Abuse. And what they found was that between 2000 and 2004, there was a 20% increase in the number of reports to Adult Protective Services, and as we'll see in the next slides, 15.6% increase in substantiated cases since 2000. So of that 20% increase, we see a 15% increase in substantiation. And Adult Protective Services, they go out and they do a very extensive investigation in order to determine whether abuse is occurring or not. And we see a really big jump just within 4 years. And some of the characteristics of elder abuse across the country is that most victims are female. So we saw that 65.7% were female. 42.8% of victims are 80 years and older. So we see an association with getting older, being female. And then very alarming and actually very eye-opening is that the vast majority of elder abuse cases occurred in domestic settings. And this flies in the face of some of the traditional thought that, well, we see a lot of elder abuse or harm that occurs in nursing homes, and a lot of people equate nursing homes with being a very risky or very unsafe environment for their parents or their grandparents, when actually leaving them in the home sometimes can be equally or even more risky. And so some things that came out of this study helped us understand some of the limitations that we face with elder abuse. So we need more accurate and consistent reporting of data. We need more detailed age, gender, race, and ethnicity specific information, because we need to understand, one, what is the true prevalence? What is the true prevalence within these different characteristics, such as age, gender, and race? And then are there different associations that occur for different ages within different races, things of that nature? And then information on reporters of abuse, such as municipal agents, postal service workers, or utility workers. There's not a whole lot of outcome data on clients served, so we don't know how well the interventions that are being provided to these older adults is actually improving their quality of life or their survival. We need increased local, state, and national intervention and education efforts. There aren't very many documented in the literature, and when I say not very many, I mean pretty much there are no published interventions on elder abuse. And then national data collection on perpetrators and the outcomes they experienced as a result of the investigation. These are all data that we need to better understand how we can characterize elder abuse cases, perpetrators and victims, and also engage in efficacious and timely interventions. And so, what about the mortality of elder abuse? We've talked about how elder abuse is prevalent. We've talked about the different types, but then what are the outcomes that are associated with elder abuse? And one of the main outcomes that is really, really important is that elder abuse increases the mortality among older adults by 300% compared to older adults who have not been abused. And this was found out in the first mortality study by Dr. Lax out of Cornell, and they published a study in 1998. So here's some data from that actual study, and what they found was that they had a fairly small sample, but they had 180 older adults who had been reported to Adult Protective Services for self-neglect, and over the 13-year period, 73 died. So they had about 40.3% died. Among the elder mistreatment group, they had 78 total cases, 31 of those died, so 53.2% died over the course of the study period. And then those who had no elder abuse or mistreatment, they had 6,649, and only 17.3% of those died over the course of the study. Now, the major cause of death in all three groups, as you might imagine, is their heart stopped. They had circulatory disease, atherosclerotic cardiovascular disease. And so, to this point, we don't know whether or not elder abuse is actually the cause of death, because it's hardly ever talked about or ever listed in the autopsy data or in the medical examiner's office notes. It may be talked about or addressed, but it's hardly ever considered to be the cause of death in this population. Now, there's another study that was conducted by Dr. Shinshi Dong out of Chicago. This study was done in 2009, and it also looked at the mortality risk for self-neglect and elder abuse. In older adults who self-neglect, African American older adults had a higher mortality rate compared to whites. Now, one thing to consider for this study is that 94% of the participants in this study were African American. And then, but what was really interesting is we still saw an increase in the mortality for elder abuse, which was around 2 for the elder abuse cases compared to non-abused older adults. But with the self-neglect, what we actually saw was that within the first year, the mortality rate was 6-fold, which means it was 600% higher within the first year. So the likelihood of a person who was older adult reported to Adult Protective Services for self-neglect, they were 600 times more likely to die within that first year compared to non-self-neglecting older adults. And after the first year, that figure dropped down to 2.1, which remains significant throughout the extent of the study. And another important note is that increased mortality was not restricted to older adults with lowest levels of cognitive and physical function, because what we often think is that these individuals who self-neglect, because they often have cognitive problems or physical function, is that really what's driving the mortality? With this study, we were able to show that mortality was increased across all levels of cognitive and physical function, which lets us know that the actual elder abuse is contributing to the mortality of this population. And so what are some of the risk factors for elder abuse? Well, there's age. We've noticed prior that people 80 and older were at higher risk for elder abuse. Dependency, which is a big thing. Whenever you put yourself in whenever you end up in a situation where you are dependent on another person, then that opens up options for all kinds of types of abuse. There's functional decline. There's personality disorders, isolation, excessive use of drugs or alcohol, poverty, cognitive impairment. These different factors present or put older adults at risk for elder abuse for different reasons, such as the functional decline. It goes back to the dependency. The isolation places older adults in a situation where maybe they're not able to provide for themselves, and someone comes in and starts providing for them, engages in undue influence, nobody can pick up on it, and this person ends up losing everything that they have. Then they end up in a nursing home or worse. And also, if physical abuse is occurring, oftentimes is not picked up on in isolated older adults. The excessive use of drugs or alcohol, this is on both of the perpetrator and the older adult, which would be the victim in these cases. We've seen that drugs and alcohol used by either one of these increases the likelihood. And then, poverty and cognitive impairment. As you might think, cognitive impairment could lead to dependency and inability to provide for oneself the basic resources for maintaining safety and health. And so, as a physician, they're in a really good position, as I mentioned before, to be able to pick up on some of these risk factors, because they do have these long-standing relationships with their clients or with their patients. And as they see a person becoming more functionally impaired, it's more likely that they are either being abused or may be at risk for abuse. Because abuse is more likely to occur if the victim is dependent on the caregiver, which we just saw. Functional decline of the victim may create undue caregiver stress or lashing out, and that's one thing we haven't talked much about is the idea of caregiver stress and caregiver burden, which could lead to physical abuse that primarily comes from just being overly burdened, overly stressed, and then maybe lashing out at the older adult or actually hitting them or isolating them or having to leave for a certain period of time, which puts the older adult at risk for injury. And then there's personality disorders, mental illness, and cognitive impairment of the elderly person are risk factors for abuse because when an older adult has a personality disorder or mental illness or cognitive impairment, they may act out that in aggressive ways that then causes a retaliation or a response from the caregiver. Now, isolation of both the abuser and the abused is a risk factor, as we mentioned before. We mentioned the idea of alcohol and drug abuse history, and these are, like I said, these are things that physician can pick up on whenever these older adults come into the clinical setting. What are some of the risk factors for perpetrators in elder abuse? Now, there's psychiatric disorders, there's dependence of an abuser on victim, there's external stressors, lack of experience or education, and caregiver burnout. And as I mentioned, these are some of the same types of risk factors that you see for a victim. So there's this sort of reciprocal relationship that may be going on, and same type of factors that lead to the abuse that may be occurring in our perpetrator population. And so let's talk a little bit about interdisciplinary teams, because what we've learned through the literature, through the discussions at round tables across the country, is that interdisciplinary approaches have been very effective and continue to be very effective for handling these cases of elder abuse because they are very complex. It's usually never the same reason why a person is abused, and if it is, there's at least 2 or 3 other factors that are involved there that require not just one discipline but multiple disciplines. And oftentimes you have a physician, you have a nurse, you have adult protective services, social workers, law enforcement, elder law attorneys, you have nutritionists, psychiatrists, psychologists. I mean, it takes a lot of different people to handle these complicated cases in order to intervene in the appropriate way to lead to better outcomes for the older adult. And so let's go through a case study here. We have Miss F. Miss F is an 89-year-old woman brought into the office by her niece for a periodic checkup. Miss F lives alone. Her niece takes her to run errands once a week, and Miss F asks her niece to wait in the waiting room during her exam, and her niece readily agrees. Here's a picture of Miss F's toenails. So her niece is taking care of her. And on physical exam, she's unremarkable except for a blood pressure reading of 190/96. And the dosage of her antihypertensives was increased 6 months ago, yet she can't tell you when the last time it was that she actually took her medications, antihypertensives. Her niece failed to obtain her prescription from the pharmacy. So what questions would we ask? What type of abuse would you consider that Miss F is experiencing? What are the risk factors that you would note for elder abuse in this case? And what is her risk of dying in the next year? So let's try to go through these and answer some of them. Okay, so since Mrs. F's niece is considered to be one of the caregivers, the physician may suspect caregiver neglect, right? Because now you have an older adult who is dependent of a formal caregiver, which is her niece in this case, and her needs are not being met. So we might consider this to be an incident of caregiver neglect. Now, the risk factors of note for elder abuse include, well, Miss F lives alone, she's dependent, she takes antihypertensives, and her blood pressure is high, and toenails have been neglected. So these may be signs of the neglect. And then her risk of dying in the next year is elevated. We can't say that her risk of dying in the next year is X, but what we can say is that if we compared her, Mrs. F, to an older adult who may not be experiencing caregiver neglect, then at any point in time, her risk is at least 300% higher. And that's what we gathered from the previous studies that we had on mortality. And so some of the conclusions for this presentation is elder abuse is common. Self-neglect is the most common prevalent type of abuse. Elder abuse is associated with increased risk of mortality, and it's a very, very prevalent and growing public health problem. And when we start thinking about interventions, ways that we need to prevent elder abuse and intervene in cases of known elder abuse, we should be thinking about interdisciplinary team approaches, because these tend to be the most efficient and effective ways for reducing harm in this population.